Dr. Don Siegel with the Arizona Institute of Footcare Physicians, and we're here to talk today about plantar fasciitis, heel pain. Plantar fasciitis is when you have the ligament or the tendon underneath the foot that runs from the heel to just over the base of the toes, when it becomes inflamed, and or when you have minute tears in that tendon or ligament. That's when you develop the pain. As you stand up, you're stretching that tendon, and until it gets totally stretched out, you're going to have a lot of pain. Many times, in addition to that, you develop a heel spur in the area, because anytime you pull on the insertion with that ligament or tendon, you develop bleeding and baby bone cells, and then you get the spur. Now, you could have a very large spur and it could be pain-free. You could have a small spur and it could be small spur or no spur at all. It could be very painful. So the size of the spur doesn't necessarily indicate the severity of the pain. Low arches can definitely cause plantar fasciitis. What you're doing is you're pronating, your feet are rolling in, actually stretching the tendon or ligament, the plantar fascia, causing the pain that I just described. Pain is usually worse when you first stand up for the first 5 or 10 minutes, then it eases off, and then it starts to get bad again towards the end of the day, especially if you're on your feet quite a bit at work. Or you're walking, say, 3 miles, maybe after a mile it'll start to kick in. You'll have the aching, throbbing, burning, shooting pain in that area of the heel. It can be on the bottom of the heel where there's a little bursa, or it can also be over here where I said where the tendon inserts in that area. That's usually where the pain is. Usually the diagnosis is made clinically. In other words, we examine the patient and we find out where it hurts exactly. Of course, you have to rule out other problems. If the patient has, say, rheumatoid arthritis, if the patient has gout, you want to rule out a stress fracture. In addition to that, you can have an ultrasound taken of the tissue, the soft tissue of the heel, in the heel area, and you can actually see small tears in the tendon, or you can see also fluid collecting in that area, and that would diagnose, objectively, something that you see actually, not subjectively, something that the patient complains about. You could diagnose plantar fasciitis like that. There are various ways to treat plantar fasciitis. The best way that we have found is usually either a steroid injection or prolotherapy. Prolotherapy has been around since the 1950s, and what it does is actually better than a cortisone injection, because it actually stimulates healing of those small tears, the fasciosis, the small tears in the tendon. In addition to that, we recommend orthotics if the patient isn't well by a certain period of time, which will rebalance the foot and take the pressure off the heel so they can walk more pain-free. We recommend stretching exercises 3 to 4 times a day against the wall. We also recommend ice massage 3 to 4 times a day, 10-15 minutes each time around the heel. Usually 85 to 90% of the time, conservative means usually gets a patient better. If you go through, say, a program of, say, 3 months or more and you're not getting any better, then surgery should definitely be considered. But as I said before, 85 to 90% of the time, usually that is effective, treatment is effective conservatively.